library location, including ours, is officially a cooling station. And also here at Central, we have water bottles readily available for people to help out with this crazy heat. So yeah, so that's pretty much all we had to have. All I wanted to say about the library there, so I can turn it over to, I guess, to Kevin or
to Sue.
I'll dive in next.
Yep.
Thank you.
Sure thing.
My name is Susan Alvarez. I am with the Office of Environmental Quality and Sustainability, and it's my pleasure tonight to welcome you to a special edition of Earth Day Every Day that also coincides with Clean Air Action Day, an annual program by our local North Central Council of Governments to bring emphasis on the importance of clean air. And we've taken it one extra step to do clean air and health. And so welcome. We're so glad you were able to join us tonight. Just a few housekeeping items. We are recording this meeting and we'll happily have it posted either on Dallas Climate Action or on our YouTube channel, along with our commissioners. And we've got everyone but the panel kind of muted so that we've got bandwidth so that everyone can make sure that we are able to hear and see our fabulous panel tonight. With that, I'd like to introduce, many of you may not have the opportunity to meet Carlos Evans. He is our new director, has been with us a little bit over 6 months, joins us from Region 6, where he worked with the EPA, focusing on environmental justice in several states and here. And I'm going to turn it over to him.
Thank you, Susan. It's a pleasure to be here tonight. My name is Carlos Evans, the Director of Office of Environmental Quality and Sustainability. I don't want to spend too much time talking. I just have a few brief comments. First, I want to thank our longtime partners, the Dallas Public Library, for presenting this special edition of Earth Day Every Day. We're so lucky to have a partner that provides us with this type of platform on a regular basis. Second, I want to thank our speakers tonight. We have an exciting lineup of health experts and community leaders from the Dallas Environmental Commission and the Environmental Health Committee. Our speakers bring a wealth of experience and expertise that will make this discussion both educational and informative for all of us. So with that, my primary role is to introduce Ms. Catherine Bazan. Ms. Bazan is the chair of the Dallas Environmental Commission. I've been lucky to work with Chairwoman Bazan as she has led the commission. There's no one more committed to protecting the environment and health of our residents, or more willing to put the time in to make sure communities see real action. We're truly lucky to have her. Without further ado, Chairwoman Bazan.
Good evening, and thank you, Carlos, so much for those kind words. I'm Catherine Bazan, Chair of the Dallas Environmental Commission, and thank you to each of you for joining us this evening for Clean Air Action Day, especially as Carlos said, to our partners with the Dallas Public Library for hosting us this evening, and for all of your work to support the environment with your Earth Day Every Day programming. As we get started, I want to just direct people to a resource of ours that is our website, our dallasclimateaction.com. And you can find information about commission members, about the full comprehensive environmental and climate action plan, or the CCAP, and our annual work plan progress. We also have upcoming meeting information, and the next meeting of the Dallas Environmental Commission will be this Wednesday, August 10th at 5:30 p.m. And links to participate will be posted with our agenda to Dallas Climate Action on Friday evening. We are here tonight to discuss air quality, which is a fundamental right, clean air, a basic right that all of our residents should enjoy. But as we know, some of our residents live by sources of heavy industrial pollution, or they're exposed regularly to transportation-related emissions, or they're sensitive to our poor regional air quality levels. And we now know scientifically that so much can depend on the air that we breathe, and that many of our neighbors in Dallas do not have peace of mind as that their air is clean. And so in May of 2020, the Dallas City Council adopted the Comprehensive Environmental and Climate Action Plan. It's made up of 8 main goals, and one of those goals is aimed specifically to improve our air quality in Dallas at the neighborhood level. In 2021, they formally created the Dallas Environmental Commission by ordinance. We are volunteers, and our purpose is to advise the City Council on the implementation of the CCAP and to support equitable and effective action to resolve environmental issues in our city. Our commission is made up of 26 members. We have 15 voting members and 8 non-voting technical advisors, 1 expert to support each of the 8 areas of our climate plan. And our ordinance also created an environmental health committee, which is made up of commissioners with public health experience and 3 committee members from the general public with expertise in public health. For the past 8 months, it has been an absolute honor to work with and for these members and to move our city forward to more equitable policies and processes that truly ensure clean air for all neighborhoods in Dallas. And I would like to start by introducing some of our panelists this evening. Our first is the Vice Chair of our Environmental Health Committee, District 8 Environmental Commissioner Renee Robertson. Commissioner Robertson is a Dallas native and a graduate of Bishop Dunn High School. She received a master's in public health from Walden University and a bachelor's of science in nursing from TCU's Harris College of Nursing. She has been a registered nurse for Parkland Health for more than 20 years and is experienced in infection prevention, critical care, surgery, and population health. She's also a parish nurse for the Catholic Diocese of Dallas and started the health ministry at Holy Cross Catholic Church. She serves on the advisory board for Parkland's community-oriented primary care clinics and has been a member of the Dallas Sierra Club for 5 years. She's also the interim environmental climate chair for the NAACP, and for her work in communities of color to reduce and eliminate environmental disparities, Commissioner Robertson was awarded the 2021 Sierra Club Lone Star Chapter Environmental Justice Award. Please welcome Commissioner Robertson. Our next panelist this evening is Dr. Folashade Afolabi. She's a member of our Environmental Health Committee. Dr. Afolabi is a pediatric pulmonologist and assistant professor of pediatrics. She has worked in the Dallas area for over 5 years, and her interests include pediatric and community asthma, school health, cystic fibrosis, and chronic ventilation in children. She's an active member of the American Thoracic Society, Texas Pediatric Society, and the American Academy of Pediatrics. She gives freely of her time and her expertise to our commission, and we are very grateful. So welcome to you this evening, Dr. Afolabi. Our third panelist is District 7 Environmental Commissioner Tamika DeRoe. She was born and raised in Dallas and attended schools in both Dallas and in Duncanville. And in 2006, she and her family became Habitat for Humanity homeowners within the Joppy community. And in order to bring transparency and helpful resources to that community, Commissioner DeRoe formed the nonprofit Joppy Freedman Town Association in 2017. Within a year, the association partnered with community residents to stop the establishment of additional batching companies in Joppy, which had been and continue to be a source of continue to compromise air quality. Commissioner DeRoe served on the city's Board of Adjustment from 2018 to 2019 and was a key stakeholder in the development of the city's comprehensive environmental and climate action plan. She's been an outspoken advocate for her community and speaks candidly about living next to industrial encroachment in her residential community. She recently participated in the Climate Reality Leadership Corps training to further support her mission of serving as an environmental justice advocate and voice for both Joppy and District 7 residents. We welcome each of you and thank you for all that you do and for agreeing to spend time with us this evening to talk about air quality.
Thank you for the introduction.
Thank you.
So I guess that kicks it over to me. One of our panelists, Ms. Renee Robertson, is having some trouble logging in. So she's getting some help right now from some of our staff, and hopefully she'll be joining us here very shortly. So in the meantime, I'm going to go ahead and kick it off and get started with the two panelists that we have, and then we'll go from there. When you do these online things, sometimes things work perfect and sometimes there's glitches. So we'll just see if what we can make it do from here. Let me start off with just sort of a real basic question, and I'm going to address this to Tamikia, because I know you've been doing this for a long time, and I guess one of the things that I'm interested in is, how did you get involved in community issues, and in particular, how did you get involved with the Environmental Commission? Tamikia, you there?
Thank you, Kevin, for the question. Because it came to my, can you hear me?
Yes.
Can you hear me? Can y'all
Yes.
hear me?
I think so.
You can hear me now?
Yes, can hear you.
Oh, where did y'all go? Okay. So how I got involved, because the injustice came to my community. I live in Joppy. I live in an industrial port. It's zoned industrial all the way around my community. That's how I got involved, because it came to my community, and I went to a community meeting and I got involved. And ever since 2017, I have been involved in environmental justice and environmental racism. I have been educating myself about regulations and how all this is affecting our quality of health.
How did you get involved with the commission?
My councilman, Adam Basador, appointed me to the commission because he see the work that I do for my community to change the environment and to protect our air quality. So when the city decided to form this new commission to stop the, to start a, what I'm looking for, to start a new concept of protecting the air quality and the climate in the city of Dallas. He chose me because of the passion that I have for the environment of Black people. I'm an African American Black woman. I live in a Black community. I live in a food desert. I live in an area where we have all kinds of injustices, and we are suppressed with a lot of neglect from the city. So when the city came up with the environmental commission, my council member knew the passion that I had, and he appointed me to this commission for I can be the voice of the southern sector of Dallas, because that's the 37 is the biggest part of the southern sector of Dallas. It covers Fair Park, it covers Pleasant Grove, it covers Joppy, it covers a little of for Oak Cliff, out for Martin Luther King over there. So it's a big district.
It is, and you have a lot of things going on in your district, and we welcome your participation and your work. Dr. Afolabi, how did you get involved in environmental and community issues?
So I've been really interested. I've been very passionate about asthma and treating asthma in my clinics, and realized that it's really hard to treat asthma just with one person, and I needed to do more. And I needed to reach out into the community in as many ways as I can. And as I started to do the research and look into how and what those things are, I saw how the environment and the consequences of things like environmental racism and redlining have really impacted the citizens of Dallas over a prolonged period of time. And so I started to get more and more involved and make myself more and more vocal as much as I could. And then because of that, I was invited to become a part of the committee, part of the commission,
Right.
the health committee of the commission.
So you're not a voting member of the commission. You are one of the experts on the commission.
Exactly. I'm an expert.
Well, we're glad to have you
I'm happy to be here.
and everything. Ms. Roberson, I'm glad you could join us. Are you on? Can you hear me? Sorry, she was on. She's on. She
I
there?
saw her.
No,
Uh-oh.
she's connecting to the audio. All right. Well, we'll come back to her here in a second. Tamikia, what do you hope to accomplish in your work on the commission? What's your goal?
More protection for the people that live in these areas. And I'm talking about me. I want more protection for my quality of life. I want clean air in the mornings. I don't want to have chemical tar smells fuming over my community at night and in the morning while I'm outside taking my morning, afternoon walk. That's what I'm hoping to accomplish. More better protection for the people in the communities.
Good. Excellent answer. Ms. Roberson, can you hear me now?
I can hear you. Can you hear me?
I can hear
We
you.
can.
We can. Welcome.
Oh,
I'm glad
God,
you could.
thank you.
I'm glad you could do it. I'm glad we got the bugs worked out. We all owe a
Okay.
thanks. We all owe a thanks, I guess, to Aaron for getting you on here.
Oh, yeah, we do.
So the first question I ask, and I'd like to get an answer from you because I know you've been involved in community issues for a long time, is how did you get involved in community issues? What got you started going down this road?
Well, I started out, I got interested because I was interested in the environment. And then there are just so many disparities between one area and another. And then I spent some time doing school nursing and noticed how many children have asthma. And it just eyeballing it without the numbers, there seem to be more children south that have it in the southern part of the city. And then as I looked at things and looked at air quality, you know, I noticed that there, like I said, there were disparities. And what I would like is just the climate to be the same. You know, PCI at Parkland has done predictors. They can predict your life cycle by your zip code, and that shouldn't be.
Absolutely, unless we all live to be the same age, that's not right. Ms. Roberson, you're a nurse, and you've been a nurse for, I guess, you're a long time, for your entire career.
Yeah.
And what do you hope to accomplish in your work here with the commission, as a commissioner and as a nurse?
What I'd like to accomplish is just some public health awareness, and the leadership whatever leadership we have in charge, an environment where they buy into what we're saying, where they understand, so that we will all be on the same page. You have to have the buy-in from the leadership because that's where the money is. You have to have buy-in from the general public also, so that they know they need to protect themselves. And we have to have public safety. And if people are not understanding, we need to help protect them.
All right, I'm going to ask Dr. Afolabi, what is your goals? What are you hoping to accomplish by your work with the commission?
I mean, I have a little elevator speech, and it's essentially to make asthma, asthma management in the community for Dallas a leader. I think that Dallas has the potential to do some amazing work to reverse the years and years of neglect that other people, that these patients, that these particular people, that these kids with asthma have gone through and have suffered. And I think that we're uniquely posed to do some very amazing things for these kids and really reverse the cycle of poorly controlled asthma in the city.
What do you think I guess I want to kind of hone in on that a little
Yeah.
bit, something you said there. One of the projects that I'm working on at the city is community air monitoring.
Mhm.
Do you see that as having a role in what you're in the work that you're doing with asthma?
I do. I really do. I mean, the data shows very clearly that areas with poor air quality have worsening, those children have worsening asthma symptoms. They have more asthma attacks. They have poor asthma control. And it's multifactorial. There's a lot of different things that play a role in that. But we know for sure that poor air quality plays a role. So monitoring, finding out where those places are, what are the things that we can do to mitigate those things, that's very, very important. And so, I think one of the most impactful things I can do, I love to do teaching. I love to do education. It's my fire. Collaboration's my fire too. But I think that one of the most impactful things that we can do is really getting the data and having the knowledge about what the air quality in those areas are and improving that air quality significantly. We really need to make our air for our children so much better in the city of Dallas.
Well, I think we're together on that, because my goal is to hopefully provide you guys with some good data that will lead to improvements. And I'm glad to be partnering with someone like you that shares that passion. I'm going to kind of throw this out as sort of an open question, and I guess take answers from all three of you. How would you rate the problem of asthma in your particular communities? And I know, Tamikia, you're in the southern sector, and Dr. Roberson, your community, I guess, is more of Oak Cliff area, and Dr. Afolabi, I guess you're probably the whole city, I would guess.
I live in the Oaklawn area. I'm District 2, but yeah.
Well, I have a personal experience with asthma. My son had to take 8 prescriptions a day to live in Joplin. He battled with asthma from a baby, I'm gonna say it really kind of kicked off age 4 or 5. He battled with asthma. Every year, March 16th is his birthday. I have medical records show that my son was at the hospital every year on his birthday with poor lung deficiency. Like, he couldn't breathe. I mean, so I have a hands-on experience with dealing with asthma. So I'm hoping this work that we are doing, like you say, air quality. The example I have, my son is 28 years old. He moved out when he was 20, 21, somewhere like that, with his kid's mother. They live in Mesquite. The first year they lived in Oak Cliff over there off of 35 in Ann Arbor. He got sick one time over there. He got asthma flared up. They moved to Mesquite, no asthma problems.
That's interesting.
No asthma problems, no albuterol problems, right? He's been staying over at my house for the last 3-4 months, right? Why he had to go to the hospital May, in April, beginning of May, because he had needed a treatment because he was here. It's air quality.
It is.
It's air quality.
My
neighbor's son, they from New Orleans. They came up with Katrina. They moved, they got Habitat homeowners too. Her son had to take asthma treatments leaving in Joplin. He graduated high school, joined the Army, he had to get a health clearance from the Army, right? Haven't had no asthma problems ever since he moved out of Joplin. It's air quality issues in Joplin.
Carlos, you have a comment?
No, I was just going to say that speaks to Emerson actually had a question that is relevant to that point.
Does everyone experience the same pollution?
Does everyone?
Go ahead.
I was going to say, you said does everyone experience the same pollution? I'm going to let Dr. Afolabi answer that.
I think that's an amazing question. That's a great question. And you think that everybody experiences the same air, right? Because air is air. But unfortunately, there's some places where there's more air that has pollution in it. And usually it's because it's either close to a highway or close to some kind of building that's making something that's stinky. And so, no, not everybody is exposed to the same pollution at the same levels all the time. And that's part of what we're trying to fix. We want to make all the levels low for everyone so that we all can breathe easy.
And I'll add to that sometimes the atmospheric conditions, the weather influences the pollution. Right now, when it's extremely hot and dry, we tend to get a lot more dust in the air. And if the wind wasn't blowing, we would be getting a lot more ozone, which ozone is an important pollutant that can also, it plays a role in asthma. So a month ago, we had this hot weather and we had very light winds, and we were having a lot of ozone days. And now the winds picked up a little bit and we don't have them as much. But so there's a lot of things that go into the air we breathe, and it's a matter of where we are and what the weather is and all of that. Ms. Roberson, what do you see in your community? You're a nurse in the community. You are, I believe, the parish nurse for for a Catholic
parish
church.
Nurse for the Catholic Diocese for Holy Cross, and I'm equally on one side of town as much as I am the other. But I do have some home health experience. I've had a patient that lived further down Simpson Stewart, and she had to go into the hospital for whatever reason. And when she came out, her daughter decided that she had asthma. Her daughter decided she would bring her home with her. So she moved to Cedar Hill. And I made my visit after she got out of the hospital. And whenever I would go and see her, she'd faithfully have her inhaler on the table, and because she lived alone at the time. And so I go to see her, and she says, and I walked in, she recognized me and everything. And she said, I said, "Where's your inhaler?" She said, I haven't had to use it. She said, "It's over here in the desk drawer." It didn't occur to me till I left her house and pulled off. And as I got on the freeway, what she said just hung in the air. And I went, oh my God. She moved from down by Simpson Stewart to Cedar Hill, and she doesn't have to use the inhaler every day.
That's impressive. That's amazing. So what Ms. DeRoe goes through or has gone through with her son is not an uncommon experience.
No, and I have several nieces and nephews that are great, that have been, when they were grade school, they have asthma, and it continues even as an adult. There are a lot of children. When I was school nurse, like I said, a lot of children have asthma, and those inhalers are expensive, and most parents have to buy 2 of them because one needs to stay at school locked up in my cabinet, and the other one has to be at home.
You're right. Those inhalers are very expensive. The price of asthma is not cheap.
No.
And yeah, I've had plenty of parents and plenty of families that have moved, and their asthma has been transformed just by a move, and that shouldn't have to happen. And it's unfortunate that it does, and it's something that we would have to work hard to fix.
Are there resources where people can go in Dallas to get help with their asthma medications and treatment? What if they can't afford it, what are their options? I mean, there has to be something.
Yeah, so it's unfortunate that there aren't a ton of resources. So for payment for particular inhalers, if you're a patient of mine, we have methods and ways to make the medicines less expensive. So if you're, kind of plugged into a hospital system, there's definitely something that you can do, but especially if you're uninsured, there's not a lot you can do to help reduce the costs. More and more of these medicines are becoming generic, which is very good, but they still continue to be expensive and outsized. And it's definitely something that we need to work on, is to bring down the cost of inhalers, because it is extremely expensive. But, you know, I would love to make those inhalers unnecessary. I tell patients every single day, the day I don't have a job is the day that I am very, very happy. I want children to be happy and healthy and breathing clean air and running and playing and not requiring medicines.
And another resource is the Texas Department of Human Service. They can apply for Medicaid, because I used that when my son, because you know, back then the Buterol was like $60 a box. That was like late 90s, early 2000s. So I can just imagine what the 60 is now, 160. So it's a resource, the Texas Department of Human Service. They can apply for Medicaid for their children. If they don't qualify for Medicaid, they do have other insurance programs for children to have medical coverage to cover it. It used to be called CHIP. I haven't been on it because my kids are grown and everything, but I do remember, because I use our resources. I'm a Habitat homeowner. That's the biggest resource in the world. So in housing. So I didn't qualify for Medicaid, but I did qualify for CHIP because I was a working parent. So if you go to Texas Department of Human Service, you apply for Medicaid, they will deny you. Then they will give you the other Medicaid called CHIP, or however they label it now, because of your income. So that is the resource to get your children covered.
And
That's
also
good information, because people usually don't know where to start.
Yeah, that is excellent information. And Commissioner Robertson, do you know about Parkland's programs? Parkland does have programs for the underinsured and
We do.
uninsured
I
as
was going to
well,
say
right?
the other option is to sign on with the clinics. I mean, sign on with Parkland has a financial plan. Sign on with that, and it gives you a primary care doctor, and from there you can get referred to the clinics that you need to go to.
And you can get some medicines for reduced amounts through
Yeah,
that program
yeah,
as well.
yeah.
And then Ms. Alvarez put in the chat Mark Cuban's
When I was
online pharmacy.
Yes, and I'll add one
when
other.
I was on the CHIP program, your copay for prescription was $5 on the CHIP program.
Yeah, managed Medicaid programs are very, very helpful, and they really do help bring down the costs of medicine.
And there's another source. St. Vincent de Paul had started a pharmacy, but they piggyback onto another pharmacy. So what would happen, let's say if St. Vincent de Paul's pharmacy, they're always looking for somewhere where they can, be housed, and because they're not standalone. And if they can be housed inside another pharmacy, those patients, if they qualify, can get their medications free.
That's great information. I'll throw out one other little piece of plug for someone that we've worked with in the past, and that is Miss Shamara Norris, who runs an organization called Positive Breathing, and she has a mobile clinic that will actually come to your school or church and I guess help with the breathing treatments then that you would normally have to go to a medical facility for. So she does a lot of good work, and she's very passionate about what she does. And anyway, just want to throw that out there. I don't have a link or anything to share, but on it, but you can find it, right? You can find it, Positive Breathing.
I know her. She did some work in Joppy. She has came down to Joppy and took some data for Parkland, because she works at Parkland too. So she took a lot of breathing tests with the community, showed some of the residents, having asthma and doing the albuterol pump treatment is a certain way you have, right, doctor, out of a, I'm not a doctor, but I'm a semi-doctor because I had a child, right, that dealt with it.
Dr. Mom.
It's a certain way you have to do it. So Shamar Norris have had her bus come down to Joppy, and that resource has came to our community.
A few years ago, we did a kind of a street fair for Clean Air Action Day, and Ms. Norris brought one of her mobile treatment units and put it on display here at City Hall, and it was a big hit. I'm going to move on, and I guess question I have that what resources do we need to make things better in these neighborhoods? And
First of all, we need to have access to primary care and specialty services.
okay. What else? Tamikia, what well, she's coughing. I'm not gonna what do you think, Tamikia? What resources do you think we need in the neighborhoods to make things better? And I don't just necessarily mean medical resources, but I mean resources to help improve the air quality. How can we go about doing that? Where do we start?
I think we can start with some of the organizations that you guys have just mentioned. A lot of times, like you said, all of us just in the last few minutes learned different organizations. So a lot of it is community education.
I think she has a lag.
Yeah, I think so.
I think so.
Okay,
I'm gonna kind of move on, just to kind of, in the interest of keeping it moving.
hey, Kevin, Isabel has a question.
We need stronger leadership in this. Our policymakers, our politicians. Hello.
Yeah, I got you. So we need stronger leadership with our politicians. That's a good answer.
Yeah. And like I said earlier, we need buy-in from the leadership, recognizing that these problems are problems.
I agree with that 100%. Carlos, you had a question, or your daughter has a question?
Can kids be a resource?
That's a very good question.
That is an amazing question. And of course, kids can be a resource. Kids can be a resource in many different ways. One way you can be a resource is you can tell us how you feel, right? You can tell us and everyone else how you feel and what you think needs to happen and what you think needs to be done. And then you can talk to your friends and you can educate your friends and you can educate your parents as you learn more about
who cares about the environment.
Sorry, do I have a lag as well?
No, you're fine. You're fine.
So children are literally the most important part of this whole process, right? The most important part. So you need to make your voice loud and clear. But you got to go to school. You got to read lots and lots of books. You got to learn all about all the important stuff, okay? So you can educate us old folks, okay?
Thank you.
That's an excellent question.
And I could add also, if you want to learn more information, aside from your school, visit your local library.
Did y'all get that? Carlos said
Yes.
that you can visit your local library. That's a good resource. When I was your age, I made my mom take me to the library all the time. And look what happened to me. I don't know. I'm going to kind of get a little technical here, and this is kind of going to be directed at Dr. Afolabi and Ms. Roberson. Can you kind of give us a brief explanation of how pollutants like ozone and particulate react with the body to cause asthma?
I have that written down. I'll let the doctor do her part, and then I'll tell you what I.
No, I mean, Commissioner Robertson, if you looked it all up, that's okay. You're free to answer the question too. So but there are many different ways that it affects your body.
I used to think my daughter used to think the library was fun.
I'm hearing a lot of background noise.
Me too.
Yeah.
Can
It's
y'all
died down a
mute
little
your
bit now.
mic unless you're speaking, maybe?
Yeah, well, there it goes. There it goes away. And it may be partly me. So I'm going to mute and let Dr. Afolabi and Ms. Roberson talk about the question.
So, so the ways that ozone and particulate matter can affect the lungs are in many different ways. One of the most immediate ways is that, especially with that particulate matter, it can get directly into your airways and it can be an irritant. That's typically if it's at super, super high levels that it's an irritant. And they always say that maybe it's not always say, they sometimes say that maybe that's not the case in more developed nations like the United States. But I wonder if that's the truth, because we've all had those moments when we've gone outside, we smelled something funny, and then we start coughing and wheezing and doing all of those other things. So you definitely can have a direct effect on the airways that causes an irritant or irritation. But in addition to that, these especially the PM 2.5 or particulate matter can cause a lot of inflammation. So inflammation, say you get a bug bite, right? You get a bug bite, it swells up, it gets red. You can have that inflammation on the inside and the lining of your lungs, and it gets swollen, it gets red, you make a lot of mucus, you cough, and you're trying to clear that cough up. But then your airways start to get tight. So you have an inflamed airway that the muscles start to tighten down, and then you end up with an asthma exacerbation. So the biggest way is through that inflammatory pathway. Now, it can also cause some long-term effects with ozone, especially as a free radical. And those things can cause like antioxidant effects that cause not permanent injury, but longer injury to your airways as well. Commissioner Robertson, do you have more to add?
Unmute yourself, Renee. While she's unmuting herself, I'm going to ask a little bit of a follow-up, and it's something that I think is important to understand, especially when we're talking about air quality monitoring and things like that, and that is the difference between acute and chronic exposure. So, if I understand you correctly, what you're saying is the PM 2.5 is more of an acute effect on the lungs and the body, whereas ozone may be more of a chronic effect. In other words, the acute effect is something that happens very quickly and immediately, whereas and the chronic is something that builds up and gets worse over time. Do I have that? Is that a correct statement?
Well, they both can cause chronic effects and long effects. There's some studies that show that, well, it's in mice, but mice that are exposed to PM 2.5, they have, or small particulate matter, they have long-lasting effects. There's some that show that mice children can have prolonged effects when they're being exposed to particulate matter as well. But when we think about acute effects, more acute effects in what I've looked at and in my research is typically seen with the particulate matter. However, you can have acute effects with ozone because we all have those ozone alert days. And those ozone alert days, we definitely see kids who have asthma exacerbations, and we are so hot, we have a lot of ozone, and that can cause a direct exacerbation as well. So both of them can cause acute and long-term effects. Unfortunately, it's just easier to explain how PM 2.5 causes those acute effects than it is how the ozone causes those acute irritant effects. But
That's
they
fair
both-
enough. I did want, but it was just a good lead in because I did want to talk about and bring up the topic of acute versus chronic. So we've done that. So I think that served the purpose. Ms. Roberson, do you have comments on what we've just been talking about?
I do. Can you hear me?
Yes, ma'am.
Okay. The literature says the same thing, that those irritants trigger the swelling and tightening up. And, you know, it's just frightening for children. They're grown now, but I have like 7 nieces and nephews who have asthma. And as small children, it's very frightening for the parent, for me, and for them. But one of the other things is that long-term exposure leads to other problems as well. Because when a child, the first 3 years of life represent the critical period of immune development. So when children should be having good air to breathe and everything, these children are exposed to asthma and to irritants that cause the asthma. And the chronic effects that continue affect them, affect them developmentally.
That's 1,000% true. And asthma and anxiety go hand in hand as well, because it's so scary to be unable to breathe. And I say that all the time. And children have the most robust, so the biggest, fastest lung growth happens in that first 2 years of life. And then it continues pretty quickly, but the fastest is in the first 2 years of life. And those little lungs, you see babies, you see toddlers, they are breathing fast all the time. They have this increased ventilation, so they're breathing in and out all the time. What are they doing if they're in highly polluted areas? They're breathing in this highly polluted air in and out so much faster than we are in these very young developing lungs. And that definitely can lead to chronic effects. You're 100% correct.
What should a young parent or a parent of young children or a caregiver of young children, what signs should they start to look for asthma, and when should they start to look for those signs?
So it can be challenging in that first 2 years of life. And they used to say you can't be diagnosed with asthma in the first 2 years of life, but that's not true.
That's not true.
But what you see are, unfortunately, kids can get up to 10 viral illnesses a year. So oftentimes they're coughing and they have a virus. But when you're coughing and wheezing and can't catch your breath, that's a sign that you may be having some problems with asthma, and you may be having an asthma exacerbation. And it's not normal to require albuterol or additional medicines in order for you to be able to breathe normally or breathe comfortably when you have a cold. I love something called sinus rinses or sinus irrigation or nasal suction. Usually once you get the snot out, a baby does this fine. When you're getting the snot out and a baby's still coughing and wheezing, that's a sign that they're having respiratory distress. When a child is running around, ripping and running, and has to stop to catch their breath, and they're coughing and wheezing, and then they're ripping and running and stopping and doing it again, that's not typically a kid that's deconditioned or out of shape. That's a kid who's having some problems with exercise-induced wheezing. And then oftentimes you can see it with weather changes. So when it goes from hot to cold or cold to hot, you can see children have more problems with their breathing, more coughing, wheezing, shortness of breath, sucking in right here, flaring of their nose, and saying that their chest feels funny or their chest feels tight.
And they get very quiet.
Yes.
Yes, I'll be honest. My son is grown. He's getting ready to be 31 years old. But when he was younger, I coached a lot of his sports. His baseball and believe it or not, even soccer. And I would see that. I was amazed at how many kids had the inhalers that they had to keep up with. And I saw those symptoms that you're talking about. And, I think there, especially back in those days in the 90s and early 2000s, excuse me, there was a lot of prejudice are things that the other kids would look at them and go, oh, well, you're just out of shape, or, you're whatever. And I guess I probably didn't know enough about it in those days to say, no, they're not out of shape, leave them alone. But anyway, yeah, I was, my son ended up being a swimmer and swam all through college. And even at the college level where he went, there were a lot of kids that were swimmers that had asthma. And I was amazed that they could swim competitively with asthma. I throw that out there. And I guess that will kind of lead to a next question is, what are some of the things that we need to do for these kids to make sure that they can lead normal lives? I mean, I know asthma is something you don't outgrow, or you don't cure, there's no cure for it. But people with asthma can lead normal lives. What do we do to make sure that they can lead those normal lives?
So there's a lot of things we can do to make sure that they can lead normal lives. And sometimes we do have to be careful about when they go outside. Sometimes we do have to be careful about the times that they're exposed to these things. Having little kids go out and play early in the morning or later in the afternoon when it's nice and cool, after 5 o'clock. 5 o'clock is probably the hottest time of the day. So after that, those are some things you can help to allow kids to play and play safely. You can also do you can pay attention to the asthma, the air quality index, right? There's studies that show that when the air quality index is high, more kids end up in the emergency room. Those are days where probably kids with severe asthma or moderate asthma need to stay inside. Sometimes kids do a little bit worse when they're inside than they're outside. There's things you can do inside, like you can, pests are a huge issue when it comes to asthma. So making sure that you're getting rid of mice, dust mites, roaches, those things are really important. Making sure that you use dust covers, you're dusting, you're changing your AC filters out frequently. Those are some things that you can do as well. But you're right, kids with asthma grow up to be adults with asthma who live perfectly healthy lives and are elite athletes. I heard, so nobody remembers this anymore. I work with trainees that are in their 20s and were born in 1990, and well, even earlier, like 2000s. And they don't know who David Beckham is, which is a sin. But David Beckham has asthma, and he had asthma his entire career, and he's a professional athlete. And so having the right medications when you have asthma, utilizing them at the right times when you have asthma, and some environmental controls such as staying inside on those high or on those poor air quality days, or some things that you can do.
One of the things that I found helpful was a lot of times when they go through that, the children lose, they're not confident. They lose, they're kind of freaked out about it. So it helps if you can teach them, if the sky looks like this, this may be a day that you use your inhaler prophylactically, just, making them know that they're going to be okay. Because if they go to the ER a couple of times, not able to breathe, they get very uncomfortable. So, and one of the other things that we experienced was my niece had an asthma attack 3 times. And 3 times here in Dallas, and 1 time when we went to SeaWorld at San Antonio. She was playing in the sand and kicking up the dust. And so we walked her in. My point is, we walked her into the San Antonio Baptist, and the first thing he said was, we're going to treat your niece for her asthma. And it took 3 treatments to open her up. When she was here in Dallas, they wanted her to go through that, having an attack more than once before they would give her a diagnosis of asthma. What they gave her was that obstructive airway disease. That particular diagnosis at the time did not cover inhalers. It didn't cover a lot of the equipment that you may need. So it's important that we train the providers too, that they don't need to go through that 3 and 4 times before you give them that diagnosis.
I'm gonna make a comment on what you just said. I think there's an important thing to take away from that is that if you have a child or if you're the caregiver of a child, you need to make yourself educated so that you are that child's advocate.
Right.
And that's something that I think every parent has to learn. And it's so important that you are the advocate for that child. That doesn't necessarily mean being the helicopter parent, but you need to know when to speak up and ask questions and make sure that that child is getting what they need. And I'll just stop there. Tamiki, I think you have something to say.
Yeah, I'm just gonna piggyback on, as a parent who had a child I had a care plan. I had a strategy. I asked questions. I didn't allow my son to go over certain people's house because of animals, because they parents probably smoked, or you have to be your child advocate. When I know, once I started dealing with it, I started recognizing when the triggers happen, where they happen, how they happen. So springtime was the worstest time for me. Spring, I prayed for winter. I was like, come on, for he can be better. I just want him to breathe a little bit. So when I knew March, end of February, I started getting my son ready. I take him, get all the prescriptions we're gonna need. I teach him how, you go over somebody's house, they parents smoking, you can't go over there, you can't go outside, you can't go to this area. But when he turned about 15, I had an allergy test done on him because I have another child who doesn't have these issues. So I'm like, what's going on? So I had an allergy test did on my child, and his asthma was really triggered by the environment.
Mm-hmm.
He's allergic to everything outside, every tree, pine, oak, every Bermuda, Augustine. He was allergic. The doctor say, ma'am, he can't live in a bottle, but he allergic to everything outside. And that will in his asthma with the other environment, with the chemicals in the air, being poor air quality and stuff. Yeah.
I live with someone who has severe allergies like that, and it is difficult to deal with at times. I'm going to kind of change directions a little bit, and I don't know if you guys have this information at your fingertips or anything, but how would you rate the incidence of asthma in Dallas compared to other cities in Texas and the U.S.? Where is the incidence of asthma higher than here, or is it lower? Where do we stand?
I looked it up actually. Let me get my paper here. I looked it up. And it changes, because whatever it was last year, this year may be different. But when I looked it up, we were not in the top 10 actually. Texas was not in the top 10, and that surprised me. Of the 200, according to what I looked up, of the 220 schools in DISD, 54% of them have 54% of them have asthmatic children, and are this is from 2018, so it's a little old. Now the national average back then was 8.3%. 54% of DISD, 228 schools, have a rate higher than that average. So in Dallas, it's pretty high. I don't know why the literature, and once again, it was 2018. I don't know why the literature showed that, but I was surprised that Dallas was not in, higher rated than the top 7 or 8.
Yeah, and so the incidence of asthma in Dallas is about the same as it is throughout the rest of Texas. But not this year, but maybe 2 years ago at least, a number of kids who came into the emergency room for asthma was the highest in the state. And so it wasn't necessarily that more kids were having asthma, but more kids had a higher severity of asthma or needed more care, or needed more emergency room care. Now, whether they had, I assume it's higher severity, but that might not be the case. It might just be that they don't have the knowledge or the medicines that they need to take care of their asthma. And that's a huge concern. That's a significant concern. And I think that we need to do more education in the community about what asthma means and how to take care of your asthma and what your triggers are. And we need parents to have what's called, for their kids that have asthma, something called an asthma action plan that tells them how to treat their asthma and what to do when they're having exacerbations, and things like that. So while the last time I looked, the actual incidence of asthma is the same throughout the state, the number of times that it requires significant medical intervention is higher.
And we had an action plan that was color coded. It went from like green, yellow, red, white, and I taught my niece, she was like 4. I taught her to point and to show me when she, started feeling short of breath or whatever, to show me put her finger on the color, so that, and I explained to her what each color meant. And they're very sharp at 4 and 5. And and sometimes if we weren't sure, I told her, I said, if you feel the yellow color, you need to let us know. Because sometimes, as for parents, it's difficult to watch them every minute of the day. They come home from school and some of them go straight to their room and they're not feeling well. And you may not necessarily know, that they have asthma going on. But a lot of it is training the children too. And I think it would be good if more supplies were over the counter that they could get without a prescription. Back then, some things that we needed, we couldn't get because she needed a prescription for it. And that was just some of the equipment's not available.
Yeah, things like nebulizers and things aren't readily available. And then the medications are expensive. There's an over-the-counter asthma medication I do not recommend, called Primatene Mist. It's epinephrine. And they took it off the shelf because it had such high risk of not doing well and being very, very sick from it. And now they've reintroduced it. I don't recommend that you take that medicine. They reintroduced it. I don't recommend that you take that medicine. I don't recommend that you give it to your children. I think you need to see a healthcare provider and get
Does it not speed the heart rate up and palpitations and all that?
It does. It does. Okay. Yeah.
Well, ladies, I think we are approaching our time limit. Actually, I think we're a little past it. But so what I would like to do is I'd like to give each one of you guys an opportunity to kind of, if you have something you want to wrap up or conclude, I'd love to hear what you have to say. So Tamikia, do you want to start off?
Yes. I just want to thank you, Kevin, with the work you're doing with air quality, because when I got into this fight in 2017, Dallas didn't have no idea about air monitoring. Okay. The only air monitor that Dallas had was on between Love Field and DFW. So I want to thank you and Susan and Mr. Carlos, y'all office, for doing the work in air monitoring. That's going to bring the data that the city of Dallas needs to protect our communities and our children. When it comes to asthma, I think moving forward, we need to educate our parents, our communities, and working people. Like educating educators. In the southern sector, most of the educators' children are asthmatic. We need to start going into schools, teaching the school educators about the issues that the children they're teaching is facing with asthma. I have been a part of the asthma study with the city DISD, and it's alarming. It's very alarming. My child was one of them. So moving forward, I just think when it comes to asthma, we need to start educating our communities how important, how to take care, how to prevent, and how to control asthma, and
Thank you.
live with it.
And thank you for that compliment. It's nice to hear something once in a while that you're on the right track. Renee, what do you have to say?
Well, first of all, I'd like to echo what Tamika was saying, because you heard me say several times the buy-in from leadership, and the rest of the city leaders can follow your lead. The work you're doing is tedious. The work you're doing is needed. And I'm just so delighted to have somebody who has the personality where you have that buy-in. And at a much higher level than community, you are in charge of air quality monitors. You recognize that we need them. And, that's, for me, that's the most thing. And then we can get data from you. You sent me some reports. A lot of this, for the non-believers that don't realize how important, how big a problem this is, it runs off the data. If we can't get the data, we can't prove ourselves. So I appreciate the data and everything you've showed me about learning how to interpret some of the data. Oh, and one other thing, Dr. Barry Lackman, I don't know if he's on this call or not, but he had a program. He used to be over asthma for children, and he had a program where he went into schools and they did that education and tried to reduce the incidence of asthma.
Thank you. And I have to admit here that I got into the air monitoring part of this because I just thought it was cool.
Well, that's okay.
I thought it looked like fun to play with the monitors. I'm teasing.
Well, I'm glad you thought it was fun.
Really?
Dr. Afolabi,
Awesome.
what is your concluding remarks?
I'm just grateful for everyone who's on this call today. I think that it's so important to have warriors for air quality to make life better, not just for themselves, but for the entire community. I think it's amazing that everyone is working so hard together to do this. And I agree that it's important for education, and we have to educate all up and down the line. We have to educate those in administration for buy-in, and we have to educate those in the community for buy-in as well. And so more and more and more of these things. And I'm just so grateful for all of you. Thank you so much for all of your hard work.
Thank you too.
Thank you to the panelists. I appreciate this. This has been a lot of fun. Let's do it again. And
awesome.
I think it was a good program. I hope I learned a lot. I hope everyone else or some of the audience did too, but I really enjoyed it. I will kick it back to my bosses and Ms. Bazan. Do y'all have any concluding remarks that you want to throw out there? I would have filled this time with questions, but I don't see any questions in the chat. So I figured this was a good opportunity for everyone to say something. I would like to say that in the chat, Aaron has posted some links, and these are links for resources for air quality. Air Now was mentioned a little bit earlier, and Air Now is the first link that we have up there. And the second link is where you can go to the TCEQ and put in your email and sign up for daily alerts for air quality. They will tell you that their best prediction to whether today, the next day is going to be a red, yellow, green, whatever day. So those are particularly, I think, valuable links, especially for parents who have kids that have asthma. And now I'll kick it back. Somebody want to, Carlos, you're unmuted, so I assume it means you have something that you would like to say.
Yeah, since you're giving us an opportunity to speak, so I'll go ahead. I just want to thank the panelists, Dr. Afolabi, Commissioner DeRoe, Commissioner Roberson. Every day here in Dallas, we're reminded of the talent that exists here in Dallas. I continue to be amazed about the quality of discussions we're able to have in this city. So thank you for today's conversation. You made these issues real and understandable. You gave parents tips, parents who have children with asthma, tips like having an asthma action plan for those folks who want to be more active and engaged. We know the types of organizations that are active, like Asthma Chasers. Kevin, thank you for moderating. You did a fantastic job. I want to note that tomorrow's the mayor's back to school fair at Fair Park. Feel free to participate. We're giving away thousands of free backpacks and school supplies. And that's all I have. Anybody else want to talk?
Carlos, I would just say I'm glad your kids were here to also add to the conversation. They were very helpful. And then I will shut up.
I appreciated their questions. They were wonderful questions. Thank you for that.
They're a little annoyed that they actually had to tell you the questions, but that's okay.
I just want to put a reminder that the Dallas Environmental Commission has meetings both in person at City Hall and virtually. We would love to have you participate. We do have public input opportunities, so please engage with us. We are on social media as @Dallas Environmental. You can follow us and get notices like for the meeting that we had this evening, and also for our upcoming commission meetings. So our next meeting will be Wednesday, August 10th at 5:30 p.m.
Thank you all for coming.
Can I add one more?
Carlos?
Sorry, just to kind of plug the library one more time, especially from watching the other Carlos's children speak. If you want to educate yourself, please reach out to your local library. What I'm going to plug is a little known service called Interlibrary Loan. So even if your library doesn't have a book or even an article that you're trying to research for, you can do what's called Interlibrary Loan. That basically makes the entire country of libraries your library. We do a search that goes out, and whoever has it available gets sent to your library. So if you want to educate yourself more, yes, you have Google, but your library is also a really good resource for that.
Carlos, how you doing? I just want to give you just a little encouragement that people are utilizing. My grandchildren visit the downtown library every other weekend.
Awesome, great.
With their aunt. And let me tell you, the feedback, they be excited. Like, they call me Gigi. Gigi, we went to the library. Gigi, we did this at the library. I mean, just for you could take back to your team or whatever, just to know that I like to give this input because, it gives y'all encouragement to keep doing what y'all doing for the department that you're working for. So just to let you know, the little kids from the Southern sector love the library. They go every other weekend.
That's great.
I wish they was here. They could tell you. They
kids. It's not just for the kids too, adults too. You can utilize your library if you want to be advocates for spreading information. You can utilize the public spaces. You can gather people and make your own advocacy group. That's at your disposal. You're already paying for it, so it's good for you to use it.
Yeah, the aunt moved down there, and she says she go to the library every Saturday. That's her entertainment.
Awesome.
One last comment from me. I see a couple of requests in the chat for the links that were posted in the chat. If you will email me, kevin.overton@dallas.gov. My email was all over the announcements and everything. If you will email me, I will make sure that a copy of those links gets sent to you. I think that's probably the easiest way to do that. So it's kevin.overton@dallas.gov. And that's all I have. I guess we're ready to close out.
Thank you all.
So
Everyone
thank
have a
everyone.
great
Thank the attendees. Thank the panelists. Thanks to Sue and Carlos for letting me do this. And we'll see you next time. All right.
Thank you all. And my
Have a good
apologies
evening.
for the confusion in the beginning.
Oh,
Thank you, Brad.
it's to be expected, Carlos. It happens every time. We have to learn to think on our feet.
Yep.